Bismillahirrahmanirrahim. Assalamu alaikum, dear students. Hope everything is fine at your end. We have discussed in detail about different study designs in epidemiology, including case control. A case control study is an observational analytical study in which subjects, a group of people, are sampled based upon presence or absence of disease and their prior exposure to risk factor is determined. In this study, exposure experience of those who have the disease is compared to the exposure experience of a similar matched group. The study proceeds from effect to cause, from outcome to exposure, from disease to risk factor. So, in this study, we compared cases with control. Cases are those who have the disease and controls are those who do not have the disease. We have to go through 4 steps while conducting a case control study. Number 1 step is selection of cases and controls. We can select cases from hospitals, clinics, or from general population. Controls should be similar to the cases in all respect other than having the disease, and we can select controls from general population or from hospitals or from relatives, neighbors and friends of cases. Rule of this study is to have one control for one case, but in rare diseases we can have 2 or 3 or 4 controls for one study person or case. Next step is matching. And what is matching? Matching is the process by which controls are selected in such a way that they are similar to cases. So, controls should be similar to cases except the presence of disease. They do not have the disease. Cases are with disease and controls are without disease, but controls are similar to cases. Third step is measurement of exposure. After selection, matching, we have to measure exposure. So, we have to measure exposure of possible etiologic factors, possible risk factors in both groups, in cases and controls both. We can measure exposure by obtaining data through interviews, through questionnaire, or from past records or from labs measure. Then after measurement is last step, that is analysis and interpretation of study results. And after analysis of data, we can find exposure rates among cases and control. We can find estimation of the disease risk associated with exposure. It is odds ratio. Odds ratio is a measure of strength of association between risk factors and outcome. Odds ratio क्या बताता है? Strength of association between risk factors and outcome. Strength of association between disease and risk factor. Odds ratio, also known as the cross product ratio. Exercise for you. In a study, 25 persons with lung cancer and 80 without lung cancer were enrolled. It means 25 cases and 80 controls were enrolled. Among with disease, 34 gave history of smoking. Smoking is a risk factor in lung cancer. Among those who do not have the lung cancer or those who do not have the disease, 44 were smokers. Now, from this data, construct 2 by 2 table, calculate exposure rates among two groups, calculate odds ratio and interpret the result. After revision, we are going to start today's session. Objectives of today's session are: number 1 is to understand the concept of bias in a research. Number 2 is to identify the types of biases in a case control study and to know the means for diminishing confounding bias. How we can diminish or control confounding bias in a case control study. And number 3 is to realize the advantages and disadvantages of case control study, because there are advantages and disadvantages of conducting every study. Today we will discuss about case control. Possible biases. What is bias? Bias is any systematic error. Bias refers only to error that is systematic in nature. Systematic error in the design, conduct or analysis of a study that results in mistaken estimates. Mistaken estimates of the effect of the exposure on disease. So, error make up all flaws in a study, distorts our result. A systematic distortion of a statistical result. Due to bias or error, study results can be distorted. Bias or error is consistent, repeatable, associated with flaw in a design, could be due to faulty equipments or caused by measuring instruments that are calibrated or are used incorrectly. So, systematic error can arise due to flaw in a design or could be due to faulty instruments, faulty equipments, faulty techniques. So, bias can occur at any step of the study, starting from selection of cases and controls, during measurement of exposure, or in analysis of a study. There are different types of bias in case control studies. Number one is confounding bias, bias due to confounding. And what is confounding? When a measure of the effect of an exposure on risk is distorted. When a measure of the effect of an exposure on risk is distorted. Why? Because of the association of exposure with other factors that influence the outcome. Factors influence the outcome. What is confounding factor? It is one which is associated with both exposure and disease. Confounding factor is a factor which is associated with risk factor and disease, exposure and outcome, effect and cause, both. So it is linked with risk factor and disease, exposure and outcome, risk factor, etiologic factor and disease, and is distributed unequally in study and control groups. Confounding factor is linked to both risk factor and disease, cause and effect both, but distribution is unequal in study and control groups. So, confounding distorts our statistical result. For example, in a study of CA larynx, due to association of consumption of alcohol, disease is CA larynx and risk factor is alcohol consumption. Alcohol consumption as a risk factor associated with CA larynx. But in this study, smoking is a confounding factor. How? Smoking is linked to CA larynx and with alcohol consumption both, but distributed unequally in study. And how can we control confounding in a case control study? First method is randomization. What is randomization? If a group of subjects is divided into two using random allocation, but the two groups will be similar to each other in all respect. Second method is restriction. In this, the subjects having the particular confounding variables or factors are not taken up at all. We restrict selection of subjects having confounding variables or factors. Third method is matching. What is matching? Matching is a process by which controls are selected in such a way that they are similar to cases except the presence of disease. So, by randomization, restriction and matching, we can control confounding in a case control study. Other types of bias in a case control study. Next is selection bias. Selection bias can occur due to selection of inappropriate cases or controls. Selection bias could occur due to patients who are admitted to a particular hospital. अगर हम किसी particular hospital से अपने cases select कर लें having particular disease, maybe these cases systematically very different from most of the patient with the same disease but who are not admitted to that hospital as regards the exposure status. Selection bias could occur in this case. Bias or error could occur due to selection of wrong control group. Controls who are not from the same source from where cases have come. अगर cases and control different source से different population से select किए जाएं. Next bias is due to memory or recall. So memory, recall or information bias. Case control study depends on past events, past history, past records. And in this case, cases may have a different recall of past events. It is natural. Then controls, because controls are without disease and cases are with disease. So there is a different recall of past events in cases and control. Those who are suffering from a disease are likely to recall much more as regards their past exposure. For example, mothers of babies with congenital malformation have better memory of exposure to past X-ray as compared to mothers of normal babies. So, memory or recall bias could arise in this case. Next one is bias due to interviewers and observers. If interviewer or observer is aware of the status of the case and control, if observer or interviewer is aware about status of case and control, cases with disease and control without disease, then he or she may subconsciously tend to ask more from a case. Interviewer or observer subconsciously asks much more from a case as compared to controls. So, due to this reason, interviewers or observers bias could arise. Last one is Bergsonian bias. What is Bergsonian bias? It is a special example of bias termed after Dr. Joseph Bergson. Dr. Joseph Bergson first time recognized this problem. He recognized that probability of admission to hospital or detection of the outcome or disease may be more among the cases simply because of the exposure. Probability of admission to hospital or detection of the outcome may be more among the cases simply because of the exposure as compared to the controls. So these are all biases that can occur during conduction of case control study. All these biases or systematic error can distort our results. We can control interviewer's bias just by doing blinding. We will discuss blinding in detail and during next session. Now we are going to discuss about advantages of this study. Number one is it is well suited to the study of rare diseases. In case of rare diseases, we can easily conduct case control. Second advantage is as compared to other studies, it is relatively quick to conduct. Third one is as compared to other diseases, it is also relatively inexpensive. So, individual researchers by small teams can conduct this study. So, it is relatively quick to conduct and inexpensive too. Fourth one is requires comparatively fewer subjects. So, with a small sample size, we can conduct case control. Next advantage is existing records can occasionally be used. This study mostly depends on past records, past information. In this study, there is no risk to subjects as cause and effect already available. Next one is it allows to study multiple potential causes. We can study multiple potential risk factors, multiple potential etiologic factors of a disease. Next is disadvantages of this study. One disadvantage is it relies on recall or records for information on past exposure. Case control study mostly depends on records of past exposure, records of past history. Second disadvantage is it is difficult to select appropriate comparison group. And this study is restricted to single outcome, one disease. We can study only one disease, one outcome. Although we can study multiple potential risk factors, multiple potential etiologic factors, but only one disease, one outcome. Last disadvantage is we cannot calculate incidence rates by conducting case control. We can only calculate odds ratio. So today we have revised case control study, different steps, biases, advantages and disadvantages of this study. Next time, inshallah, we will discuss cohort study. Allah Hafiz.